This is a complete health assessment from head to toe. After you have identified the patient with 2 identifiers, introduce yourself to the patient. Do a general survey of the patient. Do they appear the stated age, their level of consciousness, skin color, posture and position, obvious physical deformities, mobility, facial expression, mood, speech, hearing, and personal hygiene. You want to stand in front of your patient and assess their hands and nails. Is there any clubbing of the fingernails? During this time, you can also check the patient's cap refill. It should be less than 3 seconds. Next, you want to assess the patient's radial pulse for 30 seconds and then times it by 2. You also want to assess the rate and rhythm. During this time, you can also assess the respirations of the patient and the rate and depth. You also do this for 30 seconds and times by 2. Unless the patient is having some difficulties breathing or have a weak pulse, then you'll want to do it for a complete minute. As you do your assessment for each section of the body, you want to be assessing the color and pigmentation of the skin, the temperature, moisture, texture, the skin turgor, and any lesions that you find. Next, you'll want to check the patient's blood pressure. Ask them to sit next to the blood pressure cuff. For this particular patient, I also asked them to uncross their legs, as this can affect the blood pressure reading. Find the patient's brachial pulse, as this is where you'll be placing the stethoscope. Place the blood pressure cuff on the patient and pump up the cuff 20 millimeters of mercury higher than their usual blood pressure systolic level. This gives you a good range in case the patient's blood pressure is higher than normal. Next, you want to assess the patient's temperature and SpO2 levels. You do this by placing the SpO2 monitor on the patient's index finger. And then place the thermometer under the patient's tongue. You can also ask the client about any pain that they are having and assess their pain on a scale of 1 to 10 if pain is present. Next, you want to palpate the patient's scalp and cranium and inspect their hair. You're looking for any lumps or lesions, foreign objects, dryness or bleeding. You can check the patient's facial nerve by asking them to smile, frown, puff out their cheeks, or raise their eyebrows. If it is intact, these movements should be symmetrical. Next, you can assess the temporomandibular joint and assess for any tenderness or swelling. Assess the patient's maxillary sinuses and frontal sinuses. Palpate them for any tenderness or swelling. Also check for the temporal artery pulse. Next, you'll want to assess the eyes. First, use the Snellen chart to assess visual acuity and make sure the optic nerve is intact. Ask the patient to stand 20 feet away from the Snellen chart and read the smallest line that they can read. A normal patient's vision acuity should be 20/20. Next, you'll want to check the patient's peripheral vision. This is assessing cranial nerves 3, 4, and 6. The patient should be able to identify how many fingers you are holding up in the peripheral field. Next, you want to assess the patient's pupils. And their extraocular muscles. Does the patient's eyes follow the pin as you go through different positions of gaze? Are the pupils equal, round, reactive to light, and do they accommodate? Ask the patient to look off into the distance and follow the pin as it comes closer. The pupils should constrict. Check the patient's conjunctiva, sclera, and external structures for any redness, exudates, abnormalities. Next, you'll want to check the patient's ears. Check the external ear for any lumps or lesions, redness or exudates, or any tenderness that the patient may be experiencing. To test the hearing or cranial nerve 8, occlude one ear and whisper something in the other ear. The patient should be able to respond to what you had said. Do this bilaterally. Next, inspect the patient's nose. Is the patient's nose externally? Is it have lesions? Is there any redness, tenderness? Internally, is there any occlusions? Check the patency of the patient's nostrils by occluding one at a time and ask the patient to breathe in. The patient should have no difficulties. You can also place an object and allow them to smell it, and they should be able to identify the smell. Next, check the mouth and throat. Check for any redness, bleeding, lesions, lumps. To check the uvula, ask the patient to stick their tongue out and say ah. The uvula should rise. The patient should be able to move their tongue, and the gag reflex should be present. This could indicate a lesion on the glossopharyngeal nerve. Next, palpate the neck for any lumps. It should be symmetrical, and you should not be able to visualize any pulsations. Palpate the cervical lymph nodes for any swelling or tenderness. Is the trachea patent? Is the patient breathing? Check the carotid pulse and assess the thyroid gland by moving to the back of the patient and feeling for any tenderness or swelling. Next, moving on to the chest and lungs. Assess the thoracic cage. Is it symmetrical? What are the skin characteristics? Is it symmetrical when it expands? Did the patient have any barrel chest? For tactile fremitus, you want to place your hands on the patient and ask them to speak a few words. You should feel the vibrations. Palpate for any lumps or tenderness, and palpate along the spinous processes for any lumps or tenderness or redness. Percuss over the lung fields for resonance, moving side to side. Any areas of dullness should be noted. This could indicate a collapsed lung. Next, you want to auscultate for breath sounds. Making note of any adventitious sounds, such as wheezing or crackling. Next, move to the front of the patient. Assess the patient's respirations and skin characteristics. For this demonstration, the patient has on a Johnny, but in a real-life scenario, the patient would remove the Johnny. Palpate for any lumps or tenderness, and for tactile fremitus, you should hear vibrations as the patient speaks. Percuss the lung fields, looking for any dullness. Next, you'll want to auscultate the lungs in the front. Also listening for adventitious lung sounds, such as wheezing or crackles, or pleural friction rub. Next, you want to palpate the jugular venous pulse on the patient. The pulse should not be bounding, and you should not be able to view the pulse on the neck. For patients with a heart or lung disease, it may be indicated to perform a jugular venous pressure. To assess the heart, look for any pulsations and heave. This could be viewed as viewing the patient's chest, and you can visibly see the patient struggling. Assess the patient's apical pulse. This is midclavicular, fifth intercostal space. You want to palpate this apical pulse for 1 full minute. If there are any thrills present, you should be able to feel them at this time. Note the apical rate and rhythm when assessing the pulse. After the full minute is over, you're going to auscultate heart sounds. Starting with the aortic valve, you're going to listen for lub-dub, S1 and S2. This is the AV nodes closing. Next, you're going to listen to the pulmonic valve. You should also hear lub-dub. Next is the tricuspid valve. Taking note of any murmurs or extra heart sounds that you hear. The last sound is the mitral valve. Next, ask the patient to lie down so that you can inspect the abdomen. Taking note of the contour and the symmetry and its skin characteristics. Is the umbilical normal, and is there any pulsations that you can view? Auscultate for bowel sounds, starting in the lower right quadrant. You should be able to hear 5 bowel sounds within a 5-minute period. After this, if 5 sounds are not noted, you can document that no bowel sounds were heard. Moving in a clockwise motion, check for bowel sounds in all 4 quadrants, hearing 5 bowel sounds in each. Next, you're going to percuss the abdomen. Also moving in a clockwise motion. You should hear drum-like sounds heard over the air-filled structures. Palpate the stomach lightly and gently for any tenderness or masses. Next, assess the femoral pulse and palpate the inguinal nodes. For this demonstration, clothes are left on and femoral pulse was not actually located for client preference. Assess the lower extremities. Are they symmetrical? There's no swelling or edema. Assess skin characteristics and hair distribution. Assess the popliteal pulse. The posterior tibial pulse. During these palpations, you should be checking the patient's temperature and sensation in the lower extremities. Next, assess the dorsalis pedis pulse. Can the patient wiggle their toes and move their feet? Ask the patient to sit on the side of the bed, and you'll assess the range of motion and muscle strength of the upper and lower body. The patient should be able to lift their arms above their head and make small circles easily. Next, check the range of motion and muscle strength of the hips, knees, ankles, and feet. They should be able to lift their legs, ask if there's any tenderness or swelling. To assess the patient's neurological status, start by assessing the sensation of the face, arms, and hands, legs, and feet. With the cotton swab, the patient should be able to feel the sensation of it rubbing over their face, arms, hands, legs, and feet. If they cannot feel a sensation, they may have paralysis of that area of the body. Next, check stereognosis by placing an object in the patient's hand and asking them to identify it. For this demonstration, we used a pen. This checks to see if the parietal lobe is intact. Check the patient's position sense. Ask them to close their eyes, and by moving their index finger, they will tell you which way their finger is going. To assess cerebellar function, ask them to put their finger to their nose and their heel to their shin. When lying down, assess the patient's Babinski reflex. This should not be present in older children or adults. Stroke the bottom of their foot, and their foot should not fan. The toes should not fan. This is only present in infants, and if it is present in older adults, they could have problems with their pyramidal tract. Ask the patient to stand up and assess their musculoskeletal. Ask them to walk across the room, heel to toe. Then to walk on tiptoes, and then walk on the heels. Next, you will check for a negative or positive Romberg sign. Ask them to stand with their arms next to them with their eyes closed for 20 seconds. This investigates any loss of motor coordination and to detect posterior column disease or assess disequilibrium or ataxia due to disease. Ask the patient to do a shallow knee bend and touch the toes. This will assess the patient's range of motion of the spine. The patient should be able to perform these moves with no pain. Once you are finished, help the patient up and thank them for their time. And depart from the patient.